we're witnessing major changes in the management, I would say, of patients with hematological disorders, malignancies in general, but not only, even in other conditions. I mean, hematology in general has led the way towards targeted treatment, because if we go back, we opened it in oncology. We have 3 forms of leukemia which are or should be managed with targeted treatment, starting with acute promyelocytic leukemia many years ago. In fact, for promyelocytic leukemia now, for many patients, the treatment is completely chemo-free. So treating acute leukemia without systemic chemotherapy is obviously something that opens, many thoughts. Then we got chronic myeloid leukemia with the tyrosine kinase inhibitors, then the Philadelphia positive ALL, again with the tyrosine kinase inhibitors. Keep in mind that Philadelphia positive ALL was the worst condition we could ever get. Devastating. And now we can control it with these TKI, imatinib, dasatinib, etc. So that's led the way. But as you were saying, I mean, this is the beginning of a long story. And now we have many more drugs that have been developed and that indeed go and target, if not a specific marker, maybe a pathway. And we're seeing this, for instance, with the drugs that are targeting the B-cell receptor signaling pathway, interfering therefore in the proliferation mechanism of the B-cell. So it's a mechanism-driven treatment. And we're seeing this with, just to give an example, with ibrutinib, with idelalisib, for CLL, for some forms of lymphoma. These are major and very important changes in treatment. We've got new monoclonal antibodies that have been developed for myeloma, for instance. We've got new generation anti-CD20, which are extremely active. We have a very interesting not new, it's been around for a few years, but recently approved by FDA for relapsed refractory acute lymphoblastic leukemia B lineage, Philadelphia negative, and this is based on a dual mechanism targeting the B cell to the CD19, but the mechanism of control is immunomediated by activation of T cells. And that's very interesting because we're controlling or trying to control without, again, adding, let's say, immunotherapy to conventional chemotherapy. So I think the times are extremely exciting because through a better understanding of the biology of diseases, now we're getting always more towards controlling or contributing to control the disease with these different drugs, not with systemic chemotherapy. So I think it's a major, major change.